Hi, everybody. I'm Dr. Qazi. I am a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with collagen stimulation as well. I'm going to walk you through this case. It's a really nice case. I just after a single session, beautiful results. I just saw her a few days ago, and we were really blown away by how great her collagen response has been in less than a year. So I hadn't seen her since that first session back in April, and you could just see a significant improvement. So I'll walk you through this case. It's a really, really nice case, and just kind of explain what she's also told me about the progress and how it really took some time before she noticed the scars got softer and softer. So I'll go through that. You can also see the skin tone has also gotten much better too. There's some things that I did for that as well. So I'll help you out with just kind of explaining everything here. And really, when it comes to these kind of treatments, I think it's important to emphasize that there are ways to get excellent results. It's just a lot of it though depends on what kind of modalities we're using, how much downtime you could give me, how you are with essentially with sunblock, and also with your oil production. So there's a few variables, but ultimately we could still get beautiful results even in patients who are older. So I've had patients who said, "Oh, I'm in my 60s. Well, I still get improvement." Yeah, we could still ultimately get there. It's just a matter of doing the right treatment and making sure that you do the aftercare properly to make sure that there's less chance of hyperpigmentation and really less chance of severe acne coming out and oils under control. Oh, hey, I'm up. Thanks so much for coming in. Yeah, you did come in earlier today. I appreciate you giving me a shout out again. Thanks so much. Talk price. So most patients for their combination session, it's usually about $5,000 to $7,000 for them. So that's typically the price for patients for their scars, especially that first session. If they need more volume, then it could be a little bit more. And then usually, especially for like more ice pick scars, like this patient, she had to come in, and we ended up doing some Bellafill as well as some more TCA Cross. And so now the price will go up just a little bit more for those. But future sessions for like TCA Cross and future sessions for laser, those could be up to 55% off really. So I try to make it so that it's really accessible for patients. I really want that to be the case, that it's just something that people could do. And there's a lot of work that's involved, especially that first session. But I know that we're going to really be able to achieve these kind of results consistently. So that's how I do it. So that way we have that 55% off for future sessions there. I see a few questions and comments. I'll try to get to them as we go along over here. I missed some of these though. How would you treat ice pick boxcar scars on a patient prone to eczema? Actually, my patient today, he had eczema. He had a consultation for and he had severe eczema. Really, it's possible sometimes I'll just go work my way around the eczema areas. But even if we go over it, it's okay if we just hydrate the area really well. There's really certain things I may do to pre-treat the area a little bit differently for eczema patients. So a lot of times it will be more like TCA Cross and probably like more with filler. But if we need to do lasers, energy devices, it's possible to. I do that. I have a lot of my patients are also having other issues or more sensitivity. Eczema is really common too, so we definitely could do that. Do we do punch excision in this patient? I'll have to double check actually my note. I don't remember doing punch excision for this particular patient actually. This was mostly just TCA Cross. This was subcision. This was with an ablative form of the CO2 laser in some of the edges. And then we did a fractionated CO2 laser and an Erbium laser. I'll double check for sure about a couple of those scars to see if we ended up doing punch excision. I got to refresh my memory on that one. Can people prone to hypertrophic scars get CO2 laser, Erbium laser? Yes, you could. It just, about doing proper aftercare a lot of times, and also the appropriate laser settings. Sometimes after we do these treatments, especially when there's a lot more hypertrophy, what we may end up needing to do is we may have to do like an ablative form of the CO2 laser. Then what we do is I use silicone tape afterwards, and that silicone tape will actually help make it so that there's less friction there and less chance of hypertrophy or especially keloids in the future. Can you repeat what you did again? I didn't get it all. So this was with a TCA Cross. This was with Subcision. This was with an ablative formula CO2 laser for the rough edges, fractionated CO2 laser, also an Erbium laser. So I did that all under a single session, and then through the laser tunnel holes, I put a dilute form of Sculptra there for the patient. When she came in again, I ended up doing some so I did some Bellafill as well as TCA Cross. I actually forgot that I did do a bit of Bellafill this day as well too for her, so just in some parts of her cheek as well. Should you wait for your atrophic acne scars to heal, then heal first? I'm missing this question. Should you wait for your atrophic acne scars to heal, then treat them, or treat them when fresh? Really, with scars, the best time to do it is really as early as you possibly can treat them. If it's safe for us to do, we could be able to do that. I think it's important. We can really maximize our collagen response early on. Is CO2 laser permanent? Well, what we are doing is we're resurfacing the edges of the scar, and that stays with you as long as you are preventing friction afterwards. You typically don't get that hypertrophy again, and that could be with something like silicone tape. That could help keep it flat afterwards. But yes, the results for CO2 laser are yours to keep. You get to keep like that softer skin, that new skin, which is nice. It's like a lot of people always think that you have to do things like constantly for maintenance. It's not true. You can actually have a really great longevity with these treatments. The things that you may have to keep up with are volume issues. So if you lose a little bit of weight, then you can still see some indentations afterwards, and there you have to do something more for volume, potentially like Bellafill or Sculptra or Radiesse, fat transfer, all options like that. Do I do TCA Cross with 100%? Very, very rarely. Usually you don't need 100%. In fact, I had a patient today who comes in from San Francisco, and the dermatologist was using too high of concentration. It was basically like 80% for all of her scars, and she was getting scar widening. So she was coming into me now to get that fixed. So if you're using too high of concentration, that could end up happening. If you're using on the wrong kind of scars, that could happen. There's a real way of doing TCA Cross. It's it's really surprising to me when people tell me that they're doing it on themselves. I do this all the day long. I do multiple times a day, and I will never do it on myself. So it's really surprising that people would be willing to risk this acid on their face themselves. Dallas is saying, I just had a kidney transplant a few months ago. Is there a way to make the scar less noticeable? Yeah, usually with surgical scars like that, we do want to place a little bit of filler, something like Bellafill could help, or Sculptra or Radiesse, all options. And then if we need to, if the texture is a problem, we may need to do something like an Erbium laser. What's the consultation process like? So if we're doing virtual consultations, and most of my patients are actually from a distance, usually from out of state. Essentially what we do is we have you take some photos from multiple different angles, and then I'll go through it during the consultation, usually on Zoom, and I'll circle the scarred areas. I'll really zoom in on the areas that we're going to be treating, the different kinds of scars that we have. Whether it's ice pick scars or boxcar scars, rolling scars, we could tell all that with the photos and with the video. And then if you're in person, of course, I'll just go through that right there. I'll just, I'll use angled lighting and showcase each of your kinds of scars that you have and how we'll treat that. So I definitely go through really thoroughly. I don't think that anybody could ever say that it's not clear for them afterwards. Does Mederma work? I think you're asking when it comes to scars as that. It's not going to help much, especially for these kind of scars. Not going to be something that's going to help too much with that. Dylan, how's it going with you? Good seeing you on. Dylan's saying that he needs to see me. Hopefully see you soon. Let's see here. Why do you not do TCA Cross on myself? Well, it's risky. It's I do this every day, and it's like you have to be really, really steady. And I don't know how you'd be steady on your own face, placing it on there really, really precisely the way I do it every single day. It just, sometimes I see people afterwards, they've done TCA Cross, and they try to talk to me about the fact that they've gotten burned from TCA. even when they've gone to professionals and things like that, and just to get some advice for how to fix that. And it's like, they showed me the photo of what it looked like afterwards, and it's like splotchy, it's like all over the face. And if you look at mine, it's very, very precise. There's a way to do this. I'm really, really meticulous when it comes to this, because I really want to make sure that you get a beautiful result. My patient today, the one that was from San Francisco, she was telling me that her dermatologist was only doing 80%, and she asked her dermatologist if she could do lesser, and she's like, no, you just it's only 80%, otherwise it's just not going to be effective in things. It's just not true. They're quoting studies like probably from like 25 years ago or so. Like I actually know one of the studies that they were talking about. It's like the photos were terrible. It's like just a different skin type, and it's really, really risky to kind of replicate that in real patients. In this particular patient, for example, I didn't use like 80% on each of these individual scars. I changed the concentration depending on the depth of the scar. So it's to me, shocking that someone would insist that they only do 80% or otherwise it doesn't work. Clearly, it worked really well, what we did, clearly. And this is nice. This is a nice case, actually, because I hadn't seen this patient since April of last year. We did follow up with her just to make sure her pigmentation was better, but I hadn't seen her in the office actually for a long time. So it's nice to be able to see that journey. And, really, like when I talked to her that first month after 30 days, I talked to her patients just to make sure that their pigmentation's okay. And really, that's what that follow-up is really about, just to make sure you're healing okay. And she's like, I still see a lot of the scars. I'm not sure if it's going to get better. I'm like, just wait. It's going to take some time. We try to trigger a collagen response. We'll see how your body naturally makes that collagen. And like she came in, she's like, you're right. It definitely was a big difference at that 6 month mark. It was really, she started noticing when she went to family, like for Christmas time and things like that. And then she noticed that it's a lot better. And it's really nice, that we could get to that. Another thing about this patient is that a lot of her scars are lateral. So that's actually important too. I've talked about that before, that the lateral side of the cheek, that's a little bit easier to treat that more than the medial part of the cheek. The reason why is because there's less tension. When you're smiling in this area, in the central area, you can give a little bit more tension of the scar, and then that could end up causing it to get a little bit wider or potentially delaying that collagen response. It may take several more sessions, but the lateral side of the cheek, lateral cheek, responds really nice, and you can see that really clearly with this patient. Let's see where it was. I lost my place here with the questions. Did I post this online? Not yet. No, we just she just came in. I was just like, oh, this is a great result. I'm gonna just put this up on the live for tonight. But I think they already have like their scheduled for posts and things like that. But I was like, let me just put this on here. And at some point, you'll see it. You'll see it on the feed. Can applying acids like salicylic acid on the entire face make acne scars worse? I wouldn't say it's necessarily going to make it worse, but it could overly dry the skin, which could actually cause you to break out more. So I probably wouldn't recommend doing something where it's high concentration of salicylic acid, but if you're doing that plus moisturizer, it's probably going to be okay. I missed it. Are her scars completely gone now? No, she still has some on the lateral cheek, like around the temple area. She still has a few. She still has some on like the apex of her cheek. Worked on in some more with some TCA Cross and some Bellafill for those areas. I have an acne scar on my cheek. I've been using salicylic acid on my face and notice it's worse. Well, what may be happening is that it's overly drying your skin, and then when it overly dries your skin, you produce a little bit more oil production, and that may be what you're noticing actually with that. As you get a little bit more oil production, your scars could look a little bit worse. Previous saying, hello, Dr. Qazi, is it true CO2 laser enlarges pores and doesn't shrink them? Good question. Pores are really more of like a symptom of, if it really is true pores, it's more of a symptom of oil production. And so when we do CO2 laser, we're burning layers of your skin, and your skin is excessively dry for especially the first several weeks, sometimes 4 to 6 weeks or so. It's very, very dry. So you do definitely want to make sure that you're moisturizing a lot. If you're not moisturizing a lot, your skin is going to be very dry. And what's going to happen is your body's going to produce a lot more oil to compensate for that. And it's been trying to hydrate your skin with oil. So when that happens, your scars or your pores could appear more dilated. That's like really common actually. So CO2 laser isn't solving pores at all, but yes, it could for a temporary time make the pores look a little bit worse. That's expected actually sometimes if you have dry skin. Just moisturize more and it'll go away. It's not like it's like too concerning. Do you use a toothpick to place TCA Cross? I found that to be not as precise, so I usually use a paintbrush or a needle actually. I never really loved the toothpick. I thought it was a little bit too thick for a lot of scars. Did I post this on YouTube? Not yet. We'll probably have a video of this one, I think, hopefully. I'm not sure. I got to double check to see if we have the full case here for that. That'll be great. Doc, how can we reduce the risk of hyperpigmentation in darker skin types when performing TCA Cross and CO2 ablative lasers? Well, that's what I do a ton of. I make sure that we prep the skin properly. You're using sunblock. So that way we can make sure that when we do these treatments, it's really safe. But you absolutely, need to do something if you're a darker skin type. I actually don't use hydroquinone-based products. I find that there's more risk of hypopigmentation when you do hydroquinone. So I don't do hydroquinone-based products when I pre-treat the skin. So, just something to pay attention to. You can actually get my pigmentation cream on my website, but really in general for patients who work with me, that I am very careful. I don't use like excessive amount of heat or energy when I'm doing these lasers too. There's a way I do this. And that's why vast majority of patients, more than 80%, probably 85, 90% now at this point, are Fitzpatrick 4 and above. I have these kind of scars. Can I go with CO2 laser? Well, that will help. Yeah, CO2 laser will help for like those thicker edges, and it'll stimulate some collagen, but this needed TCA Cross, this needed subcision, this needed some volume as well. So by itself, not going to be really enough. How far apart are these photos? This was in April 2024, and now we just saw her a few days ago, just here in January 2025. Do you give training on FCO2 laser and TCA Cross procedures to medical doctors? This year, we probably have a couple slots that are full already for training, but I will see, if there's time. We're really, really busy. I'll see when I could do some more training though, if it's possible. But yeah, I've done it last year. I did it to dermatology residents last year, and we've done others before in the past. But you can always submit that you're interested in doing a training, and at some point we could try to get around to helping you out there if it's possible. Gabriel saying, "Hi doctor, my dermatologist just put me on hyaluronic acid in my deepest scars. Is it right?" Are you talking about topically? They just told you to put topical hyaluronic acid for your deepest scars, or are they saying that they injected that? Daniel saying, how much do the procedures cost? Estimate for the most you ever charge for acne scar treatments? Most patients are $5,000 to $7,000. If you need a lot of volume, and if it's a really more severe case, that could go up to like $12,000 to $20,000 sometimes for some patients. Not necessarily at one time, but over the course of the 2 years or so that we've been working on things, it could get to that. Depending on how much volume loss there is. If there's a lot of volume loss, it could get to that. It really depends on the severity of your scars. And really how much improvement you're trying to shoot for. I can't find anyone who does TCA Cross in my city. Kate is saying that she cannot find anyone who does TCA Cross in her city. That's because there's very, very few people that do it. And it's really difficult to find somebody you could trust, to be honest with you. Really, really difficult. The problem is that it's something that takes a lot of concentration, and it's something that was sort of like poorly taught, by studies in the past. So it turns out that like certain techniques just are outdated or just weren't appropriate for certain skin types and certain kinds of scars. And I wish I could say that like I would trust a lot of people with TCA, but I just I really won't. I just can't. It's just the way people do it. I see it, and the way they splash around. There's so many people in my area that do that, and I see it sometimes. It's like, they're causing acid burns on patients sometimes. I miss a bunch of things. Would a patient like this ever have glass skin or always some type of scar? Well, this level of scarring, I would not say that she would get glass skin. I really think that needs to be like outside of our lingo, especially for patients who have had acne or had scars. Really don't think of it in terms of glass skin. Think of it really instead that we're making it so that you're going to feel when you're looking at yourself in the mirror, your scars are not as visible. You're going to feel like other people aren't looking or noticing your scars as much. That is really close to what we could achieve for the vast majority of patients, depending on what your starting point is and how much work you want to do with this. But like true glass skin, like a lot of different factors are involved there. What we have to look at is just sometimes your ethnicity, genetics, how oily your skin is, how deep your scars are, how much volume loss there is, things like that. Those are all factors in there for something like that. Yeah, your skin type is a really huge potential barrier for things like this, because it's possible that we're not going to be able to achieve that look without the significant risk of causing like prolonged hypopigmentation or hyperpigmentation. And that's something we'd have to talk about to see. Like I don't think that's going to be worth it for anybody. What is the name of this procedure? This is really, I don't have like a fancy name of my things. This is just TCA Cross. This is with subcision. This is with ablative CO2 laser and fractionated CO2 and erbium laser. Do the scars cause volume loss? Well, the acne, the cystic bacteria there, that could actually basically, when it explodes, it could destroy some of the collagen in your skin and also sometimes destroy bits of fat. So it's more the acne that did that. Is this after one session? In this case, actually, this was after one session, which is really remarkable, actually. This was after one session, actually. Last time I saw her was in April, and so you can see amazing actual improvement in this case. It's interesting. She didn't do like collagen supplements or anything like that, but I was actually really impressed when I saw her just a couple of days. I was really happy with her. She's really happy. She said that she started seeing the most. She did this in April, and she started seeing the most improvement in December, and like now it looked even better. So really nice. That kind of fits like that 6 months sort of timeline that it starts to work a little bit better. But honestly, like for my own skin, when I did lasers, I find that it works like a year and a half later. That's when I started noticing that improvement. I have to double check her age. Actually, I just don't have her chart in front of me, but I'll take a look and see what that was. I'm not entirely sure. She's not like in her early 20s as far as I remember though. So if that's the question, but I just had a really nice robust collagen response too. Any procedures for scars on jawline and neck? Well, we likely would need to do a little bit of subcision there, usually blunt cannula subcision for that area. I usually don't go and use blades for that area. TCA Cross is good, and then also some laser in some localized areas there. But in that area, you can't go too hot with lasers or any devices. Can't just burn it down. You got to go pretty carefully when you do that there. So I usually don't go with like blades. It may take a few more sessions in the neck area, the jawline and neck. Thank you, everybody. Appreciate everybody for the nice remarks here. What treatment would help with hyperpigmentation? Well, the Pico laser is really what I do a ton of. Pico is amazing for hyperpigmentation. And a lot of times what we do is we want to make sure that you're using a really strong sunblock, and we usually want to do something to suppress pigmentation so it doesn't come right back. But as long as we're doing those things, especially if it's more like post-inflammatory hyperpigmentation, for example, really we can make sure that it's kept under control, less chance of it coming back. So it's really, really rewarding. Do you recommend Epiduo Forte for acne? It's fine. I just find it could be a little bit overly drying, to be honest with you. So that's why I tend not to use it. I tend to use more of like a straightforward, like proper antimicrobial, like Dapsone, and then like a low dose of a retinoid is usually what I end up doing. But I kind of stray away, or I kind of shy away from things that are like overly drying on the skin. So I found that a lot of dermatologists, when I was like suffering from acne, they really just tried to like overly dry my skin. Really, it was like just like this constant battle, and it was like I just trusted it. I just went along with it and just said, okay, like I'll just do that. But I found that it was like really like frustrating because I was just like a dry skin, and then I would still break out a ton, or it would just like be patchy and like just like be not great. And personally, I thought that it was unhelpful. And so when I change patients and I make sure that they don't overly dry their skin and don't wash their face as much as they do, don't use as many exfoliants and things like that, your skin gets a lot better. So, I think a lot of that like old theory, the thought that like you just have to dry acne isn't correct. I really don't agree with it. And I'm I don't care what anybody says about that portion of things, because like, I know I lived through it. It wasn't great for me. It's not great for my patients. So it's like, and actually one of my patients today, she kept on battling cystic acne. She was like saying the same exact thing today, that like people were just overly drying her skin, and it's like breaking her out. And it's like, that's just the thought process, just dry people. And this is the consequence sometimes, that you get persistent acne because your skin's dry and your body tries to produce oil, and if there's bacteria on the surface, you get some cystic lesions there. Nevus spilis treatment. So that's like a little brown birthmark. We would normally do just actually a pico laser if it's bothering you. So usually just a pico laser could be actually one of the better options, or you could do a Q-switch laser for that. So that's typically what I end up doing for something like that. Let's see, where was I at? Can you use your HSA for skin scar treatment? I know some people have submitted their HSA. I don't know. I have to ask my team if they were successful with it. People have tried to do it. I'm not opposed to it. Try, if you want to get that done. I just can't guarantee that HSA is going to cover it or anything like that. But I think it definitely should be covered by insurance. It's not covered by insurance. Like I tried to do like a little movement before the elections to get people to get the candidates to talk about that a little bit, but I don't know. It didn't seem like it ever got picked up. And the way things are going, I don't think that they're going to be adding more stuff for insurance. It should be covered by it though. Would you recommend TCA Cross after a CO2? There is a way of doing that actually. Like basically after you do a CO2 laser, you can see like there's these deep ice pick scars, and you can go back and actually put a little bit of TCA, a little bit of acid inside those. I usually do it beforehand though, before doing the laser, because the swelling there after the laser is going to hide a lot of the other scars. So that's typically what I do. But there is a way, actually, some people will actually like it doing it that way, where they do laser and then they still see those little ice pick scars, and then they'll go after those with TCA. Is Aerolase laser the same as a Cure laser you do? No, Aerolase is a 1064 wavelength laser, and 1064/532, whereas the Cure laser is actually 1726. So 1726 is really precise for just oil, whereas the Aerolase could actually be for like also for some pigmentation, also for hair, and really pretty mild for like oil. Do you recommend any doctors out of California, like you're saying outside of California? Well, there's very, very few of us in the world, to be honest with you. So it's tough to really say. There's probably one doctor I would say that's probably, somebody I would say that, like, at least from what I can see and everything like that, does a good job. But beyond that, it's like very, very difficult to kind of be able to push or say that there's enough, out there. What percentage retinol for someone new to it, and how often should be used? The easiest thing to do is actually you could do like you could get adapalene and get like 0.1% adapalene and start there, just so you get that over the counter. That's a nice way to really start. What did you do to achieve the results in the photo? It looks great. Well, thank you so much. This was with TCA Cross. This is with Subcision. And this is with ablative CO2, fractionated CO2, fractionated erbium laser, a little bit of Bellafill as well. And then through the laser channel holes, you put a dilute form of Sculptra for this patient. I got to double check to see if I did excision. I can't remember offhand if I did an excision on there. I may have. I just got to double check. Sometimes when I'm doing these subcisions, sometimes I do a little bit of excision for like those one or two spots, but I can't remember if I did it for this patient. I'm up saying, Doc, I'm scheduled to use a pigmentation cream in 2 weeks and was told not to use harsh topicals. Does that mean starting now or when I start using the pigmentation cream? That means when using the pigmentation cream, really. That's what the case is, really. You could do your creams right now, but just be really gentle when it's time to do the pigmentation cream. Alex Morgan saying, does fungal acne, back of the neck, and forehead leave scars as well? Yes, sometimes it could. Yeah, it could. That's potentially for some patients, especially like the back of the neck, it could actually still be very, very deep scars for them. Do you think that there will be a permanence effect of cross-linked hyaluronic acid given on scars superficially with needles like a permanence effect of HA on the chin, nose fillers? Good question. I do think that that's possible because you're undermining sometimes that scar tissue, placing a little bit of volume in there. You are giving a little bit of that volume, and there's a bit of integration with the tissue and tiny little bit of fibroblast activity whenever you inject something like hyaluronic acid. So possibly doing it over and over again could give a bit of a permanent effect. The problem that I have though, and you mentioned it's cross-linked hyaluronic acid. So the problem I would have though is that it could shift a bit more, and then also it could draw in too much water. So typically you would want to actually use non-cross-linked hyaluronic acid, and that doesn't have much of a permanence effect. I would say it's really temporary, like only going to last you maybe maximum like 6 months or so. You're using more like cross-linked, then you could draw in a little bit too much water, and it could shift. It could cause more inflammation in the superficial pockets of skin. So you run into problems like that I think it's worth kind of mentioning that with hyaluronic acid filler for scars, there's a bit of a barrier because you're doing it superficial, and then you could end up drawing too much water unless you use which I use non-cross-linked hyaluronic acid typically. Let's see here. My dermatologist injected hyaluronic acid in my deepest scars. Is it right? Yeah, that's what we were just talking about right now. That's okay, especially if it's due to volume loss. If it helped your scar, that's okay. That's totally fine. What does something like this cost? I desperately want to fix my scars. Most patients for their combination sessions spend about $5,000 to $7,000 on their scars, typically. That depends though on how much volume loss there is, but that's most patients. And if people are asking the cost and the consultation prices, just go to my page, drqazi.com, and you'll be able to see most of our prices are on there, other than subcision, but pretty much everything else is on that page. So, and you could get a consultation there as well. Is IPL best for H-spots on appendages or pico laser? Depends on your skin type, really. IPL is okay, it's fine for that, but if you're a darker skin type, I really don't recommend it. I do think of the energy devices, it's more risky. It could end up causing more pigmentation issues. So you gotta be really, really careful with IPL. And sometimes people gap it too much. There's a few problems with it. It's like, not as easy of a device to do as people make it seem. I know that like sometimes it's an esthetician's office, things like that. You could run into more problems with it though than like the pico laser, for example. Now, of course, you gotta be careful with the pico laser too, but like I think the problem is that people that have IPLs, a lot of times they seem to underestimate the technical skill that's involved with it, and just like kind of really paying attention to skin types and things like that. Certain skin types, it can be really risky. All right, guys, I'm going to wrap up. I'll answer this last couple questions, though. It says, what about glycolic acid? Can it help acne? So I do like chemical exfoliants in general for acne. It's a nice option. I usually just do it once a week, though, instead of doing it more frequently because it can overly dry the skin. And this final question, how long is a downtime for a combination treatment? When can the patient wear makeup to cover it? So downtime is typically 7 days, 4 to 7 days for these scar treatments. Like this patient was 4 to 7 days. For makeup, really the thing with makeup is that it's gonna overly dry your skin. So I usually would prefer more with like tinted sunblock. If that's probably gonna be the thing I would probably recommend doing. But after a couple weeks, you could wear makeup, but just mostly tinted sunblock is probably gonna be the best option. All right, guys, thank you so much. I will see you again tomorrow. So you got a sneak peek at a scar result that I kind of jumped the gun to show because I was like, oh, this is awesome. I saw her a couple of days ago. We got this ready for us really quickly this time, but stay tuned. We'll see.